Thank you to everybody for being here. And at Caregiving Cafe today, we have Dura Sims from Two Heart Hospice, who makes it possible for us to gather on Zoom. And today we have a special guest, Dr. Krista Jenney, who is Doctor of Physical Therapy, who will talk to us about something that people don't usually talk about, which is the pelvis, and how to keep it healthy and what you can do to stay strong. So I will let you introduce yourself a little bit, actually a lot better, Dr. Krista, and tell us a little bit about your background. And I know nutrition was part of it as well. And that's also so important, because my mother was right, darn it, prevention is better than a cure, so moms sometimes do know best. And so anyway, take it away, and there will be time for questions and answers afterwards. And Krista is also available for consultations. She is local. All right. Thank you so much, Dr. Krista.
Yeah. So I'm a physical therapist. I specialize in pelvic floor therapy. I'm actually Lita, who introduced herself as my mom. So I finished high school in Austin. I went to UT Austin and majored in nutrition there. And then I did my doctor of physical therapy at Texas Women's University in Dallas. So today what I thought we would do is, as caregivers, I'm sure sometimes you're having to do transfers with the people you care for. So I set up some chairs back here. I have my boyfriend who'll help me demo how to keep good body mechanics to help prevent injuries to yourself. Because like some of you have said, like if you're not healthy and taking care of yourself, you can't take care of others either. So I guess first, before we do that, I have my little pelvic model here. So this is the pelvic floor. Everything you see in red is all muscle. So, I mean, this is a female model, but males have all these same muscles. They kind of act like a hammock underneath your pelvis. So when they contract, it helps hold urine in. It helps when you have increased abdominal pressure, if you're pushing, coughing, laughing, sneezing. So say if you have leaking with those, it might be because your pelvic floor is not turning on like it should be. And then the pelvic floor can also get stuck in tension. And some signs of tension could be like UTI-like symptoms, urinary urgency, frequency, burning sensation. So the pelvic floor is involved in all urinary, bowel, and sexual dysfunction. We don't have time to go over all of that, but I just wanted to give a quick little intro on that. And before we get more into pelvic health, I'm going to do the transfer demonstration for you. All righty here. So I have two chairs here. So say you're doing a transfer. Here's it on. You're going to want, so say he's in a wheelchair. You're going to want to make sure you take off the armrest and the foot pedal on the wheelchair on the side that you're going to transfer away from. It's usually easy to transfer towards the stronger leg. So we'll say that his right leg is stronger. So we're going to transfer towards his right. And don't feel like you have to take notes. I have a bunch of stuff written up that I'll have them send you guys. So when we're transferring, we want to actually turn away from where we're transferring. So I'm going to ask Adon to make it so that his heels are facing towards this chair. And he's going to scoot forward as far as he can in this chair. And you're going to have your feet about hip distance apart. Zara, we have the dog here. So you're going to have your feet hip distance apart and your heels are going to be flat on the floor. All right, so he's here. I'm gonna want my head to be closer to the chair he's moving to. And if you have a person you're caring for that their knee buckles or that weak leg is just weaker, you can use your knees to help kind of block their knee. So I have my knees kind of just like this together, blocking his knee, so that way that knee doesn't buckle when he goes to stand up. So I'm gonna have him lean forward. You can always have a gait belt on that you could grab, or you could grab under this leg. So you see my head is on this side, the side we're transferring to, and then you can do a little rock. Wait. So we're gonna count to 3. We're gonna rock 1, 2, and then on 3, we go up and over like that. So making sure that you're hinging from your hips, not bending through your knees, trying to keep a relatively flat spine. So that is a squat pivot transfer. And now going to the other way, I'll do a stand pivot transfer. So you can only do this if they're able to stand full weight bearing on one leg. So again, we'll pretend now his opposite leg is stronger. So now his left leg is stronger. We're transferring toward that side. If I was blocking the weaker leg, I'd be over here. Yep, again, his heels are facing towards where we're going. He's scooted forward as far as he can in the chair. I'm going to have my head on this side, grabbing under. I'm going to bring my hands to his back to help bring him forward. And then we're gonna do that same rock and we're gonna come all the way up to standing. So 1, 2, 3, he stands all the way up. And then reaches back with his hands for the chair. And then you can slowly, again, bending from your knees, keeping your back relatively flat, down to the chair. All right, thank you, you're done. All right, does anyone have any questions on those?
Can you just mention briefly something about a gait belt?
Yeah, so a gait belt, I actually don't have one here with me though, but it's basically kind of like a yoga strap that you put around yourself and it has a buckle. So it's just something you can hold on to with your hands. So that way you're not having to hold on to their pants.
All right, thank you.
Yeah. Anyone else have questions on those before we get into the other stuff?
Let me just mention one more thing. Age of Central Texas has gait belts if you need one, because I had never heard of one and I didn't know how to use it either. And but they have gait belts at Age of Central Texas at the help center, and I can send that out by email, and they're for free. Everything that they offer there is for free. So before you rush out and buy something, check with Age or check with me, and I'll direct you. Okay, thank you.
Perfect. All right, I'm gonna go share my screen. Or was there another question?
I had a quick question. We're going to need to order a wheelchair for my dad and he could come home in the next day or two. We were told to just go ahead and order it on Amazon because trying to get it through Medicare and through the whole process is really time consuming and they're just not available. They mentioned I had training yesterday at the hospital on transfers. And so when I look on Amazon at a wheelchair, are they going to let me know if the handrail and the foot holds are removable?
It should say in the description.
Okay.
But I know there are some chairs that are more just like transport chairs that maybe wouldn't be able to remove them, but
okay.
No, it can be, it could take a long time to get your customized wheelchair. Yeah. But sometimes like a church community or just, reaching out on Nextdoor or something, asking if someone has a wheelchair that they were using for something else. Sometimes you can find a spare one to use temporarily.
Age
okay.
also has wheelchairs that they give out, and they have a lot of them.
Yeah.
Oh, really?
Is that what you said, Age?
Yeah, because wheelchairs are expensive.
Yeah, and that's what I was just saying. Age of Central Texas. I'll send out the number. I'm gonna find it as quickly as I can. Call them first before you go out and buy anything. Call them. You might have to wait a day or two, but let me know and I can help you try to get things. If they have it on hand, it's free, including wheelchairs. You also, Diane, need to know his weight. Because my husband needed a wider one. It goes by weight. It usually will say if whatever is removable or not. There's a difference between a wheelchair, which has a big wheel, and a transfer chair. And maybe Krista, can you describe the difference and the different uses?
Well, yeah, so it's gonna probably be more lightweight. And it's more for just like transferring from like, say the house to the car or short distances, versus the more customizable chairs will be able to remove the armrest and the footrest, and you can customize the depth of the seat and how high it is off the floor, the backrest height. There's a lot of things you can customize when you go through the insurance and get one.
Yes. Diane, talk to me. Let's talk before you buy anything. Okay. Because if you need be, you can use my husband's.
Oh, thank you.
Okay. Temporarily, because, yeah. Okay. All right. Thank you. All right. Thank you, Krista.
All right. I'm just making sure I'm able to share my screen here. It made him sign in. Let's see. Share. All right, do you see it?
Yes.
Okay, perfect. All right. I don't know how to open it full screen, but we're just gonna scroll through here like this. So I gave this PowerPoint to Lynn so she can share that with you. I also did make some handouts that goes over some initial info that I sent to Lynn as well. So yeah, don't feel like you have to take notes, everything. This was that squat pivot transfer we did, just the steps of how to do it. And then the stand pivot steps of how we do it. And there's also a link to a video here on YouTube that shows someone else doing the same things I just did right there. So if you ever want to go back and watch those. All right, before we get into some other pelvic health topics, first we're just going to talk about using the toilet, because this is something we do multiple times a day. And if we're pushing, straining, really bearing down on our pelvic organs, it can have a big impact because we're causing that stress every day of our life. So when we're on the toilet, especially if you have any constipation or have trouble getting all your urine out, it can be really helpful to use something like a squatty potty, or even if you just put some rolls of toilet paper on the floor or a trash can upside down, whatever you can do, some sort of blocker stool. You can see in the top image that this muscle that kind of goes around like a lasso, that's called the puborectalis. And in sitting, you can see how it's pretty tight, pulling the rectum into a kink. And when we bring our knees up above our hips, that kind of relaxes and has a more straight flow to be able to defecate more easily. So here in this image, that's me on my squatty potty. The hips are higher than the knees are higher and wider than the hips. And you want your feet to be nice and flat on this stool. So when we're using the restroom, we want our muscles to be fully relaxed. So doing deep breathing, relaxing, just trying to be nice and loose to let things come out naturally, and shouldn't really have to think about straining or pushing down too much. And I know when we go out and we're not at home, sometimes there's a feel like you need to hover over the toilet. Really trying not to do that. You can always put toilet paper on the seat or use those covers. Trying not to hover, because that's going to make it so that your muscles are tensed and they're not fully able to relax like they should. And again, taking your time to completely empty. A lot of us are in a rush, especially if we're caregiving for someone and you power pee or really push and strain when having a bowel movement. And all of those things just make you much more likely to have pelvic organ prolapse. And that's obviously something we want to try to avoid. And then when you do have an urge to use the toilet to go, number 2, trying to make sure that you don't wait more than 15 minutes after you have an urge. If you wait longer than that, that urge may go away, and then that can make you more prone to being constipated. And number 1 thing to avoid constipation is really staying hydrated. So as a typical goal, want to have at least half your body weight in ounces per day of plain water. So that's at least about 6 to 8 glasses of water a day, which I know can feel like a lot. And as we age, we need even more than that. So that's just for our daily toilet habits. And then there are also some breathing techniques you can use to help further relax the muscles to be able to go to the restroom more easily. So diaphragmatic breathing, like I mentioned, this helps stimulate the vagus nerve, and which is part of the parasympathetic nervous system. And when that's stimulated, it's more easily to use the restroom. So something you can do is like pretend to blow out a balloon or a candle. So like take a big inhale and just use that breath to help defecate. Also performing horse lips. So that's the lips that not everyone can do. And then, or just saying a low-pitched noise. Low-pitched noises also stimulate the vagus nerve, whereas high-pitched noises would not stimulate it. So any loud noises like a moo or an om, like you would hear in yoga class. I know maybe you don't want to make those noises when you're out in public, but if you're home alone or you just say them quietly, that can work too. For those who have trouble fully emptying their bladder, so this is something that could make you more prone to UTIs if you always have urine in your bladder and you're not fully able to get it all out. So those same breathing techniques can help to try and do them at the beginning and end of your stream, just to make sure that everything's out before you stand up. You could also, if you're on the chair, you could try rocking back and forth, side to side. You could try standing up and then sitting back down to help unkink the urethra. And then another thing you can do is the sacral nerve roots innervate your bladder. So you could even just put your hand on your back and tickle your back to help stimulate and try and get the rest of your void out. And then trying to make sure that you're going to urinate at least every 4 hours if you're having trouble getting out all your urine. Typical voiding schedule for urinating is every 2 to 4 hours. So trying not to go more than every 2 hours or less than every 4 hours is a good goal for that. All right, moving on to bowel health. So in order to have good urinary health, we need to have good bowel health. If we're constipated, the stool in your rectum is going to be pushing on your bladder, making you have more urgency and frequency. So the 3 main pillars of bowel health are hydration with water. So like we said before, about half your body weight in ounces per day. And making sure you're consuming enough dietary fiber, at least 25 grams a day. We're going to go over more about fiber on one of the next slides, but just planting the seed here. And the next thing is movement, aerobic exercise, anything just like walking, ellipticaling, anything just to get your body moving is going to help keep the motility in your colon working better. These are some of the tips I've seen help people just for constipation, things you can do in your normal morning routine. So maybe having a hot drink, whether that be tea, coffee, hot water with lemon, whatever hot drink you like in the morning, or having a hot meal. This can help stimulate the bowels. So doing that before you try to go for your bowel movement, making sure that you're chewing your food thoroughly. And certain foods like flax seeds, chia seeds, prunes, and raw fruits and vegetables can help with constipation. Also, if you have a magnesium deficiency, that can slow down your bowels. So making sure that you're getting adequate magnesium. Some food sources are listed here: nuts, seed, beans, legumes, dark leafy green vegetables, and whole grains. Another thing you could do is after having your meal, taking a 10 to 15 minute walk or just doing some mobility exercises to help get your body moving. And on the next slide, I'm going to go over some bowel massages you can do on your abdomen that you could either do while sitting on the toilet or before, just to help get your colon moving. And then as a pelvic floor physical therapist, we do a lot of fascia and visceral work, a lot of manual therapy. So that's something we can do to help with any restrictions or muscle tightness that might be contributing to constipation. So overall, you want to try and establish a bowel routine, trying to go at the same time every day, maybe adding that warm beverage, then eating a meal, adding some walking or other exercise for 15 minutes, doing the abdominal colon massage we'll go over next, and then sitting and trying to have your bowel movement. All right, so here on the right, you can see there's two techniques for the bowel massage. So this first technique, you're gonna be making circles. It's usually best to do this laying down. So you're making clockwise circles. You're gonna start down on the lower right, and you're just gonna make a clockwise circle around your abdomen, all the way down and around. So your colon is kind of like this big half square here. So we're going all the way around this way, applying pressure, making those circles. And then another technique is called the ILU massage, which stands for I love you. So the first one is we're gonna make an I. So you're on your left rib down to your left pelvis, doing about 10 strokes per letter. So first is I, doing strokes here. Next is L, across from the right to the left rib and down, about 10 strokes doing the L. And then the U is all the way from the right hip to right rib, across to the left rib and down to the left hip. So making that U. So about 10 strokes in every letter for that one. So those are two that you could just try to see if one works better than the other for bowel massage. And then for the first one, you could do it like 5 to 10 minutes per day if it helps you out. All right, moving on to urinary urgency and frequency. So like we said before, in order to have good urinary health, we need to have good bowel health. So we need to be drinking normal water normally. I know it can sound kind of counterintuitive if you're saying, oh, I have to go to the bathroom all the time. Why would I want to drink more water? But when we cut down on our water, we're actually making our urine more concentrated, and that's going to irritate our bladder further. So the more diluted our urine is, the less likely our bladder is to spasm and to cause you to have that urgency and frequency sensations. Another thing we want to do is try to avoid just in case peeing. So like I said before, the normal urinary voiding schedule is every 2 to 4 hours. So trying to avoid going to the bathroom every hour, or avoiding just because you see a gas station on the road stopping to use the bathroom. Unless you know you're going to be out of the house for like 3 hours, trying not to. And some people, they have to pee every 15 minutes, and that's just something they have to work towards. So maybe you just slowly start to try and increase those time frames. So maybe going an hour is all you can do, and then eventually work up towards an hour and a half, and eventually up to 2 hours. So, bladder irritants are another thing that can cause urgency and frequency because they can irritate the lining of the bladder. Not everyone has all of these that will impact their symptoms, but just something you can try is to eliminate coffee, things with caffeine like coffee, tea, and soda. Also carbonated drinks like carbonated water, also soda there, dairy milk, chocolate, artificial sweeteners, spicy foods, and acidic foods, anything like citrus vinegar, tomato-based products. And again, not all of these will impact everyone, so you can kind of just test it out and see which ones would affect you. And say you can't give up coffee, you could always just drink a cup of water and then have your coffee and drink a cup of water after, or for some of the other ones, dilute them with water and see if that makes an impact for helping your urgency and frequency. Now, say you are on your way to the bathroom and you're like, oh, I just can't make it in time. I'm going to pee my pants right here before I get there. These are some techniques you can do. So I want you to give yourself some self-talk. So say, I didn't have to go pee this bad 5 minutes ago. I can hold this. So, stop, take a breath. So diaphragmatic breathing is 360-degree breathing. So your ribs expand on the inhale and come down the exhale. So you're trying to expand 360 degrees on the inhale and then naturally just exhale as you would normally. So stopping, telling yourself you didn't have to pee that bad 5 minutes ago, taking some nice deep breaths, that bladder self-talk. Can also try to do 3 to 5 quick Kegels. So that's that contract, relax, contract, relax. So a Kegel is basically imagining like you're squeezing around a marble and pulling it up and in. And then as you relax, you're dropping that marble all the way down. So that's something you could do to kind of slap your bladder in the face and say, no, we didn't need to do this 5 minutes ago. Get yourself together. And then mental distraction techniques. So like you could just try unloading the dishwasher or counting backwards from 203s or whatever kind of gets your mind off of, because it's kind of a neuro bladder connection that's hyperactive that we have to kind of train out of. And then say you're sitting and you have this, you could always sit on your heel to apply just some pressure to your perineum to try and get your bladder to relax. So those are just some tips that you can do if you ever have urgency. That might help. All right. Now I know some of you mentioned UTIs before, so we'll talk a little bit about that. So like I said, pelvic floor muscle tension can cause UTI-like symptoms like urinary urgency and burning sensation. I mean, obviously you want to get tested to make sure you don't have UTI first, but just knowing that those sensations could be from pelvic floor muscle tension as well. So some other things that could cause UTIs are not drinking enough water. Again, we need to stay hydrated to keep our urine diluted. Not emptying your bladder regularly or completely. So some of those bladder emptying techniques can really help to make sure you're fully getting everything out. Sitting in hot tubs or in wet clothing and bathing suits is a really good situation for bacteria to thrive. So trying to avoid those situations if you are prone to UTIs. The other thing is vaginal dryness. So especially as we age or are postmenopausal, we have decreased local hormones to our vulva. So sometimes we can have atrophy of the tissues there, and there can be kind of thinning of the tissue. And when the tissue thins, it's more likely for bacteria to get in. So some people do go on topical estrogen. I'm not a medical doctor, so I can't prescribe that, but that is something you could ask your doctor about if you feel like you are having a lot of vaginal dryness and irritation. That can help plump back up the tissue and make it less likely to get UTIs. And then underlying medical problems, just like diabetes, kidney issues, obesity, are just some underlying conditions that could make you more likely to have UTIs. So we already know, re-saying it again, trying to drink half your body weight in ounces per day, staying hydrated, trying to use the bathroom every 3 to 4 hours, trying not to go over 4 hours because we don't want that chance for bacteria to build up, making sure you're wiping from the front to back and staying dry after emptying the bladder. So especially if your loved one is wearing diapers, making sure they're not sitting in a wet diaper for a long time. If all these things can be applicable to you or the people you care for. So if you're sexually active, making sure you're emptying the bladder after sexual intercourse, because it can put bacteria up the urethra. And like we said, avoid wearing moist, wet, or sweaty clothing for prolonged times. Also, we want to avoid using soap or fragrances near the vulva. So when we use soap in that area, it can actually cause a decrease. It can change the pH in the area and can affect the microbiome, which can make it more likely to get UTIs. So all you really got to do is if you have a shower head, you can spray it down there, or you can use your fingers, just trying not to use soap. The vagina is self-cleaning, so we really don't need to be using any products down there, because we want to keep that microbiome intact. Again, we want to avoid constipation. And there are some supplements that have shown some efficacy in helping prevent UTIs. Cranberry supplements, the active component is called PAC. D-mannose supplements, as well as probiotics. We're going to go over some foods that contain natural probiotics next as well, and then avoiding the overuse of antibiotics. I know someone was saying before that if someone does have cognitive changes, that can be a sign that there is an infection, but you do want to make sure that you actually do have an infection before you get antibiotics, because it could make you more prone to get more antibiotics in the future if you are using them when you don't need them. All right. All right, moving into fiber. So there are two types of fiber, insoluble fiber and soluble fiber. So you can think of insoluble fiber as like the strings in celery or the outsides of corn kernels. It's kind of that insoluble part that doesn't get gelatinous, or it just kind of stays solid in water. This type of fiber increases GI transit time and helps with constipation, promotes the mobility of your bowels. Again, sources are really pretty much all vegetables, whole grains, fruits with skins, beans, legumes. Again, you're thinking about those kind of hard fibrous structures in produce. Soluble fiber on the other side is more like oatmeal. Like, think about foods that become gelatinous and kind of absorb water and hold it. This is going to decrease the transit time, help you feel fuller longer, delays blood glucose absorption, can help lower cholesterol, helps filter out toxins. Again, some sources, we said oats, barley, beans, legumes, potatoes, flax seeds, chia, nut seeds, fruits. And we want a good ratio of insoluble and soluble fiber. If the food moves too fast, we're not going to absorb as much nutrition as we want. And if it moves too slow, the colon can absorb too much water, causing drier and harder stools, which could make you more prone to constipation. So trying to get a good balance of those two. All right, now moving on to prebiotics and probiotics. So prebiotics are found in a lot of natural produce. So they are the fiber and undigested carbohydrates that is food for our microbiome. So our colonic bacteria feeds on these prebiotics and helps with healing and decreasing inflammation in the colon. So some sources, fruits, vegetables, whole grains, beans, legumes, garlic, onions, asparagus, apples. There's more, but there's a lot of sources of prebiotics in lots of produce and grains. Probiotics are the actual live beneficial bacteria. So when you hear probiotics, that's what people are taking the pill. That's the live bacteria that's actually living in your gut. Some natural food sources are fermented vegetables, kimchi, miso, sauerkraut, tempeh, and kefir or yogurt, including non-dairy alternatives with live cultures added. So if you didn't want to be on a probiotic, I know sometimes there's so many out there and it's hard to know exactly which bacteria you need if you don't get a stool sample. So just trying to get some of these probiotic foods in can be helpful as well. Those were all of the topics I had. Did anyone have any questions or want to go back to any of those slides?
Questions, comments? Oh, I loved everything you said, Dr. Krista. That was wonderful. I'm happy to say that taking care of my husband, we have followed most of those things. I can't give up coffee, but I'm drinking more water.
Yeah.
So to counter that. So questions from anybody? Comments?
You said something about drinking your weight, half your weight in water. I was like, well, wait, what was that? So can you go back to that?
Yeah, sure. I don't know if I actually wrote it on the slide, but half your body weight in ounces in water per day. I don't know that. I don't think I actually wrote it on the slide. In pounds. Half your body weight in pounds in ounces. So body weight divided by 2 in pounds is how many ounces you should try to aim for at least per day of water. Yeah, I didn't write it on here, but.
Gotcha.
Yeah.
So why is that? That's a lot of water. I mean, depending on how much you weigh.
Yeah. I mean, yeah. Yeah, our bodies are 70% or more water. So your body needs a lot of plain water. And a good thing to do is just when you first wake up in the morning, if your urine is a darker shade of yellow, that probably means you need to be drinking more water. Our urine should be pretty clear when we wake up and urinate. Later on in the day, when you urinate, you can hyperhydrate with water, and that can kind of make your urine seem more clear. But that first time you urinate, first thing in the morning, is a good status to see how your hydration is.
Gotcha. Okay.
Okay. All right. Would you recommend, I had read that the body can get dehydrated overnight just because you go, if you do sleep your 8 hours or 6 hours, that much time without water. So is it a good idea to drink water before bed?
If you're having to wake up at night to urinate, probably not. The goal is to slowly, consistently drink water throughout the day. When we drink a lot of water at once, our body then thinks we have enough water and it might just put it straight through you. Whereas if you're sipping consistently throughout the day, your body can actually absorb and use that water.
Okay. All right. Thank you. I'll have
Is
to
it
try
like I start off every morning with at least 3 Diet Cokes, like the cans, like, you know, like this. Is that?
Yeah.
And then I don't drink the rest of the day, but is that probably not the right way to start? I'm assuming.
If you're having any urgency frequency issues, or constipation issues, we really want to be trying to get a lot of water. And I know plain water, I know it's hard, especially people that aren't used to drinking plain water, but
That
yeah.
too.
Yeah.
Yeah. And I have mentioned before that I am now a water drinker. I'm more of a coffee drinker than a water drinker, but I heard it too many times from my mom and from my sister, who was a yoga instructor. So, but a little bit, like my mom would keep a small glass, maybe half a cup of water that every time she went to the kitchen, she would drink a little something. And I think that was a really good way to drink it. I try to drink 1 cup at once and then I have to run to the bathroom, but I'm trying to drink more water throughout the day. But it's also, it's something to get used to it when you have to make a change in your habits. You know, you can ease into this change. It doesn't have to be cold turkey. So that might be more doable. And maybe less offensive than just, you know, giving something up.
And maybe then just, you know, giving something up.
Okay, I was hearing some sounds there. So did you have something?
I have a question. So both with my mom and my mother-in-law, whenever they started to get some mobility issues, one of the first pieces of medical equipment that they wanted was like a toilet riser. So they didn't have to strain so much to stand up. But now I'm starting to what you said, if maybe that could have contributed to some of the issues that they both had and have with constipation. If they're just not in the right position, what do you think about that?
Yeah, so in that case, you can turn like a trash can upside down and put their feet on it, or get a stool to, like, they can still have their toilet seat raised, but then trying to find a way to elevate their knees if you can, if they are struggling with constipation.
Mm-hmm. And I would go, the next step is just to make sure that that thing is removed. Let's say if you put something under their feet to remove it before they get up.
Right.
Yeah.
It's easier to get up from a sitting position. My husband had one too, but because they could fall.
Right. Yeah.
So, or maybe grab bars if they don't already have them, but definitely get that out of the way. So, all right. Anybody else? Oh, yeah.
Just you know, for whoever I think that had the UTI, my mom had 3 UTIs back to back, and we were, you know, wondering what's going on. And she thought she was drinking a lot of water, because she's like, I love water. I drink water all the time. And, you know, finally we went to the urologist. It was like, how many is a lot of water? And she was like 4 cups. And it was like, oh, you know, and that was with the tea and with the coffee and whatever. Yeah. And so we bought her one of those 9 a.m., 10 a.m. type bottles. And that really, like the one that has the marker, especially if, you know, Dora, if that's new to you, then you can kind of see the progress. And it's amazing because she herself would be like, oh, like I'm behind, you know, and I need to catch up. And so then she'll chug. Now the problem is remembering that she has that bottle and remembering to use it and reminding her to use that bottle. And that was made a big difference. So just a tip.
Yeah, I have my water bottle with me every day I go, constantly sipping throughout the day.
Well, that's admirable.
I have a question. My mother's all of a sudden experiencing bowel incontinence. So are there exercises or anything that I can do to just kind of help her?
So the external anal sphincter, which is here, sometimes that muscle can be inhibited and isn't contracting as it should, or you don't have enough strength to hold into stool. Sometimes people, if she gave birth vaginally and had any tearing, sometimes there can be scar tissue restrictions kind of holding the external anal sphincter open if you don't have enough strength or mobility, mobilizing the tissue to help make the anal sphincter able to close. But yeah, that's something a pelvic floor physical therapist could definitely help with.
So Diane, you might want to talk to Dr. Krista.
So somebody was telling me, we were talking about urinary incontinence, and they were saying that ask your doctor, there's a new chair that I guess is supposed to help with.
Oh, the Emsella.
What is that? So she couldn't remember what it was, but what is this?
Yeah, the Emsella is something you can sit on fully clothed. It's very expensive. And it sends waves. I don't exactly remember what the technology is, but it does contract and release. I think they say they do like 200 Kegels in a minute or something, which this can be helpful for people if you're assessed by a pelvic floor physical therapist and you are trying to do a Kegel and there's just no contraction. That kind of device can be really helpful to help you gain that awareness to be able to engage and relax. Other than that, I wouldn't say I recommend it. It's very expensive. And if you are able to get your own contraction, you should be able to do your own exercises and form that mind-body connection using your own motor control, I think is more beneficial.
Gotcha. Okay.
Makes a lot of sense. Thank you. Right. Any other questions? She's here right now. So, Lita, were you saying? Oh, okay. One of you is muted. Okay.
Do you recommend for Kegel exercises like it's something you do throughout the day? If you have weak pelvic floor, how do you start to restore that on your own?
Sure. So I would say if you're having any symptoms of tension, like pain with sex or urinary urgency frequency, pain with bowel movements, any type of like pelvic pain, then I would refrain from starting them after until you see a pelvic floor PT and they make sure that you don't have a lot of tension. Because say your pelvic floor fully relaxed is here, fully engaged is here. Say a lot of people are stuck in a half contraction. And if they just start doing Kegels, they're going to make their urgency frequency pelvic pain worse by doing contractions, not being able to get that full range of motion. So in pelvic floor PT, we can help you get down fully, be able to gain that mind-body awareness of what it feels like to be fully relaxed, and then you're able to train in that full range of motion.
And is pelvic floor PT covered through insurance, or how do you go about seeing somebody like you?
Yeah, so I am at a network, but there are people that do take insurance. I know that there are very long wait lists. Some people who take insurance have about a 6-month wait list, but you could try to get on a list for insurance, but I am at a network.
And to see you out of network, out of pocket, what would the fees be?
Sure, yeah. So I do home visits where I come to your house, and it's $260 per visit. And
is there a minimum amount of time that you see before somebody starts to see results, or?
It really depends on what exactly you're coming for. If you have more chronic pelvic pain, it can take a while for your symptoms to get down, but as an out-of-network provider, we don't have the restrictions that insurance puts in place. So we're able to teach patients more how to take care of themselves at home. So, I mean, when you go to normal PT, you're going 3 times a week, where sometimes I only see my patients once a month, or I'd see them. So if it's a weakness problem, it takes over 6 weeks to gain strength gains. So I might give you your exercises, have you do all your stuff at home, and then we'll reassess a month later. Or if it's more tension related symptoms and you need a lot more manual therapy, I can teach you how to do those techniques on yourself. Or you can, if you don't want to do those techniques on yourself, then you can come in more frequently. But it's really up to what the patient wants.
Thank you.
Yeah.
Does one go to a doctor first and then see you to come up with a diagnosis, or how does that?
So in Texas, we do have direct access, so I can perform an evaluation without a doctor's order, but then after that, I have a referral form that's pretty easily to be able to send to your doctor to have them sign for a referral.
Oh, okay. And do you prescribe any meds at all?
No,
or-
as a physical therapist, we don't prescribe any medications.
Okay, all right, okay, all right. So, all right, any other questions? All right, we're gonna go drink the water.
This is like an hour.
Yeah, yeah.
Okay.
Every session is an hour, and I come to you at your house in the comfort of your home. So yeah.
Yeah.
Actually, one other question was for the coffee and tea drinkers. You know, does that count? I mean, yes, you want to drink just plain straight up water, but then, you know, the green tea or the coffee, does that count towards your daily allowance at all?
I'd say no. I mean, if it's in a smoothie, sure, but if it's paired with one of the bladder irritants, I'd say no.
Mhm.
Thank you.
What I have heard, and I try to very quickly ignore, is because I am a coffee drinker, is for every cup of coffee, I guess it would be tea because there is caffeine in that. If you drink one cup of coffee, you need to drink 2 cups of water. So I'm like, I don't know.
Dilute it.
So I'm like, okay. So I'm trying to cut down on the coffee. I just love coffee, so I like tea too. I like everything. So but anyway, so to kind of be more conscious and deliberate about what I'm putting into my body.
And I mean, if it's not causing you symptoms, there's no reason you have to stop drinking it. But if you are having symptoms of urgency, frequency, and not being able to make it to the bathroom on time, or having pain, then it could help. But
no, I have no symptoms. It's just if I don't drink my coffee. That's But no, the other thing I was going to say is I made a conscious effort to drink a lot more water. I think I was drinking it too much too quickly.
Yeah, spacing it out is important.
The urgency, it was like, oh my gosh.
But yeah,
And
because
I
your body
never-
goes, oh, I don't need all this water. Sure.
Yeah, okay. So I hated it that. It was like, oh my gosh, I better start wearing diapers, but I'm like, so I cut back to a more normal, I guess.
Yeah, sipping consistently throughout the day is great.
Okay, mother was right. Okay, anybody else? Questions? No? Okay, comments? All right. Well, thank you so much, Dr. Krista Jenney. I'm so proud of you. Okay, so and please thank Adan for being your helper.
Thank you, model.
Okay. So, all right. Well, we have recorded this presentation and we will share it when it is ready for distribution. So, but thank you very much for your time and for your education. I will be sending along your contact information. And I just have to say that the Jenney family is very serious about taking good care of their body. And it just makes so much sense. They live that way. And it's, I mean, I've learned a lot from you, both Lita and Dr. Krista. And it just makes me think more about what am I doing to my body, and also the environment and all of that, but that's a different story. So, but what goes in your body really matters. I'm not giving up chips and salsa, but I don't eat the whole bag anymore. Not in one sitting. So, and if I do, I'll never admit it. So, all right. Well, thank you so much. And everybody, thank you for being here.